Okay, good morning for those that have just joined us. We're now at 10:02 and attendees are still joining, but we have an awful lot to get through today, so I propose that we start. My name's Steve Hales. I'm the Director of Business Services for Tideway, but I'm also the Chair of the Board of Trustees of Mates in Mind, a charity that was formed to deal with the stigma of poor mental health within construction. And I'm delighted to be chairing this webinar in collaboration with the Institute of Employment Studies. For those that aren't aware, Mates in Mind is now in its 6th year, originally formed from the Health and Construction Leadership Group with the support of the British Safety Council. And as I said, to address the stigma associated with poor mental health within our industry and extend support across the industry, predominantly to the SME, micro and self-employed within our industry that we believe account for some 85% of the construction population. I'm pleased to say that more than 75% of supporters of the charity are within that category, and therefore the smaller organisations. But we also have a number of business champions, larger organisations, and working through supply chain networks and trade bodies to ensure that we try to get that support to the right people. And what we're trying to do through the charity is to educate and create awareness programs to improve mental health, to offer tools to manage stress and anxiety, and generally increase awareness to focus on the supply chain itself and get as far into the supply chain with this key message as we possibly can, all the while making sure that we're aware of the early signs of poor mental health and how we can intervene and address that before it ends up in crisis. That's why, from a personal perspective and on behalf of the Board of Trustees of Mates in Mind, I was delighted that we were successful in securing the funding from B&CE's charitable trust to run this research in collaboration with the Institute of Employment Studies. We had previously had success with B&CE and were awarded the Molam Award to carry out research within apprentices and younger people within the industry and how mental health was affecting those or that cohort. And this is all about extending that further into where are the hard to reach areas within construction, and what more can the charity do to support those within SMEs and those within micros and self-employed. I'm not going to go into the detail. I'm delighted that we've got two distinguished guests with us today in Stephen Bevan and Dame Carol Black, many of whom I'm sure you're aware of. And in a second, I'm going to invite Stephen to talk through the headlines of the research. The full report itself will be released in March, and it will be presented at the Health and Wellbeing at Work event in Birmingham. It will be chaired by Stephen, and it will be supported by Sarah Casemore, the Managing Director of Mates in Mind. So before I hand over to Stephen, just a little bit of Stephen's background. Stephen's the Head of HR Research Development at the IES, the Institute of Employment Studies. He has almost 40 years experience in the field of research. His specialist expertise in workplace wellbeing, performance and productivity. And at both the IES and in his previous role as Director of Research at the Work Foundation, he's led a number of projects for both the public and the private sector, both in the UK and internationally. He's advised government on policy, including in several EU member states. He's currently working on projects entitled Work After Lockdown for the Economic and Social Research Council. He's the principal investigator of a major DWP-funded randomised controlled trial to assess the impact of job support for people with depression, and a major programme of work looking at obesity stigma in the workplace. He's co-investigator at the Centre for Musculoskeletal Health at Work at the Southampton University, and he's an expert advisor to the government's Thriving at Work review. I'm delighted to invite Stephen to give us the headlines of this research.
Brilliant. Thank you very much, Steve. It's great that Carol's able to join us as well. I know Carol has for a long time been a strong advocate of trying to promote better mental health in the construction sector. So it's really great that Carol can join us. What I'm going to do is take you very briefly through the main survey headlines from the survey we've been doing amongst this very difficult and hard to reach group within the construction sector. This is sort of a bit of an interim report in the sense that we also have some other work going on where we've managed to secure some interviews with people who participate in the survey, so we can get a little bit more detail about their personal circumstances and to try to illuminate, I suppose, the main research question for us, which is what sources of support do these self-employed construction workers trust? And if they're not seeking support, what more could be done to try and marshal resources so that they get better access to support when they need it? And that's, I think, the primary thing that we're aiming for. So if we go to the first slide, just to give you some background about this, we know, I think most of the people here today will know that there's still a very high prevalence of mental illness, mainly anxiety and depression amongst construction workers, and people in this sector have up to 3 times the national rate of male suicide, and that's been known for a while. It is partly demographic, it's partly occupational, but it's really difficult to untangle the two. But we know that this is a particularly at-risk group, and because of the nature of their work and their working arrangements and the atomized nature of self-employment, for example, in construction, it's really hard to get to them and to find out a little bit more about their needs. And this survey is really part of that process. As Steve mentioned, we were very grateful to receive funding from BNCE and their Occupational Health Research Award. And it's meant that our 2 organisations have been able to collaborate on this research where we've been talking to each other for a long time about this, and it's great to actually get our teeth into a substantial piece of work. The survey we've been doing has really been focusing on understanding what the causes of mental ill health may be in this population, what sources of support they use, and why, and some of the reasons why they don't use them, and then what future measures and resources they may need to support them in the future, because this is a challenge that has been with us for a while and remains likely to be with us for a few years yet. If we go to the first slide to talk about the actual study itself, we designed a questionnaire with reference to some previous studies which were reviewed as part of our initial literature searching, and we've also incorporated the general anxiety disorder measure, the GAD-7, which is a well-established, well-validated, very widely used measure of anxiety. I guess one of the challenges about reaching this group is, as researchers, you have hundreds of questions you would like to ask, but we recognise that for this group, we've had to pare the questionnaire down so that it only takes a few minutes to complete. Because these people are often on the move, they're working difficult hours, and so we've had to try and make sure that the questionnaire has been fit for purpose and that it doesn't take up too much time, because we want to try and maximise response rate. We used a variety of techniques and tools to try and get hold of these people, via our links, certainly makes in minds links with trade, with retailers, with social media, and with our various mailing lists and approaches to try and get hold of people. And that's been moderately successful. I think we'd all like the survey response to be slightly higher, but we've got over 300 responses, and they're all good quality responses, and people filling in the questionnaire and also adding free text answers to some of the questions as well. The part of the research that I'm not able to report on this morning is the follow-up interviews. We've just started those, and they'll be exploring some of the themes that have come out from the survey data, but we'll be completing the report in late February, and the report will be published in March, as Steve has said. So I'm now going to take you through a few slides with charts, which makes me feel a bit like Chris Whitty. But I'm not going to go through them in detail, and some of them are quite small, so I'm not going to expect you to read these in detail. But what I have helpfully, I hope, done, particularly if Paris presses the next button, which will bring up a little box. Can you press the next button? Is it not working? Animation effects. Right. Okay. Well, there we go. Right. So what we have here is the answer to the questions that we asked them about what the main causes of stress and anxiety were. And this is these bar charts represent the proportion of people replying who said that those causes appeared in their lives quite frequently, on most days, or always. So these are the sources of stress that people are feeling most frequently. And there's quite a long list here, and the box really gives you the headlines. So the primary things that are causing them to have challenges with anxiety are their workloads, and there are issues around pressure at work, the amount of work they are having to do. These are very busy people, which I guess from a business point of view is good, but many of them were struggling to cope with the workload, and were arguing that their workload was sometimes too high. There were issues around relationships with colleagues and business partners, the pressure from work, but also some non-work things such as family issues, so a lack of work-life balance or a lack of ability to spend time with family, financial concerns, and a significant proportion, just over 1 in 5, were worried about the impact of COVID on both their potential health, their family's health, but also on their business. I guess there's no real surprises in some of these. I guess 1 in 5 also saying, for example, that they still have an anxiety that they may get hurt or injured at work, and obviously that has potential implications for being able to continue work or on their earnings as well. But I guess you would expect most of the things on these lists to be sources of anxiety at the moment. If we go to the next slide, we've also asked people about if they were experiencing low mood, what are the things that they have been doing? To what extent are these reactions or actions featuring in what people are doing in order to seek help or to help them to cope? This is the percentage of people saying yes to the following things. The one that comes out with the highest score is considering quitting or changing your job. So I guess that's the ultimate escape from a situation that's causing you mental health challenges. Next comes people finding themselves drinking more or using alcohol more frequently than usual. And I suppose related to that, although with lower frequency, is a proportion of people taking non-prescription drugs as well as prescribed medication. We found that fewer than 1 in 5, if you go to the next box, Paris, please, fewer than 1 in 5 asked their GP for support. And I suppose one of the concerning things for me, at least, when I first saw these data, was that it's the same proportion of people say they were had considered self-harm as those who get counselling, and I found that quite concerning. It's obviously concerning on two fronts, really. First, that so few people feel that their GP is a trusted source of support, and also that relatively few will consider counselling or therapy as a way to help support their mental well-being. So this is a group of people who essentially are not seeking mainstream medical support for their mental health problems. If we go to the next slide, we asked questions about who they speak to about mental health. And if you press the next button to Paris, we'll get the box up. It's interesting that in the top chart, part of the chart, that top bar is essentially people saying that they provided support to other people, so family members, friends, colleagues, and so on. So it seems that this group is feeling more comfortable giving advice to other people about their mental health than seeking support for their own mental health. Part of the answer to this is in the second bar, which is basically people saying that they still think there's a stigma about mental health, which stops people from talking about it. And obviously, across this population, that goes for them too. It does seem that they seem to have quite a lot of reluctance to talk about mental well-being, and in general, their willingness to seek help and the action they take to seek help is pretty poor. They're not really doing very much. They seem to be working through it, trying to be resilient through it. And again, in this slide, repeating a theme from a previous slide, they don't see GPs as a major source of support in this area. Plus, they're not really talking very openly about their mental health to colleagues or to professionals. They may talk to their family members, but again, fewer than 50% are doing that. And most of them are saying that they feel that talking about their mental health is quite hard. We go to the next slide. We asked a number of questions about in the future, what sources of support might they consider? And obviously this is really important if we're going to try and pull together some different approaches to supporting this group in the future, because clearly some of the things that are available at the moment aren't either being accessed, they're not known about, or they're not trusted. And this is the percentage of respondents saying that they would be very likely to access these sources of support. If you press the next button, Paris, we'll get the box out with the headlines. And perhaps unsurprisingly, friends and family were the most trusted sources that people would feel most comfortable talking to. A little bit below that are charities, people like organisations like Mind and various other nationally recognised mental health charities have sort of moderate support. And I think also trade body resources, and I'd include within both those categories actually, Mates in Mind, as organisations that I think people are beginning to hear more about, and would potentially be trusted sources in the future, perhaps with a bit more work. And certainly those sources are all favoured over GPs, helplines, leaflets, social media, and so on. So in general, some of those more straightforward mechanisms of support are less well favoured. Our early analysis of how this breaks down by age suggests that amongst the younger groups, as we'll see in a second, the average age of this survey population is 47. But when we've looked at the responses from some of the younger respondents, we see, perhaps unsurprisingly, that social media and more online support is more likely to be favoured by that group. So that might suggest that some differentiation in the way that we plan and deliver support may be sensible, because obviously people favour different channels and different sources. If we go to the next slide, we ask people a few questions beyond their mental health, and particularly focusing on physical health. If you press the next button for the box, please, Paris, we can see there are a number of other physical health issues that are affecting this particular population of self-employed and SME-based construction workers. Poor sleep is a really significant one, and leading to fatigue at work. And obviously we all know from our experience and what the research says that poor sleep and fatigue obviously elevates the risk of accidents at work, and obviously that's a sort of double concern. And we also know that if people have poor sleep, particularly persistent poor sleep quality and duration, that can have a big effect on levels of mental well-being too. So it's potentially a vicious cycle for some people if their anxiety is causing them to perhaps, for example, have poor sleep. We've also found quite a significant proportion of people, 70%, with back, neck or shoulder pain. as well as other chronic musculoskeletal pain. And again, we know from the research that somewhere between 20 and 30% of people with musculoskeletal pain also have mental health problems, which can just exacerbate the problems of wider health. We also, in these data, have a significant proportion of people saying that they are more irritable as a result of their health problems, that they're having more headaches and migraine, that they're having eye strain, and so on. And we've also found that in this population, just under 1 in 5 have had a diagnosis of COVID. Now, this survey was conducted mainly before the Omicron variant, so that proportion may have increased since. But I guess one of the conclusions we can reach from this is that just thinking about people's mental health in isolation may be a limiting way of thinking about this, and that we need to think about people's physical and mental health and how they interact, because clearly for this group, they're experiencing quite high levels of prevalence of both. The next slide is the results for the anxiety measure. And again, if you could just give us the box, Paris, with the headline. These are the 7 questions that form the GAD-7. And the way that we use this is we can combine them all together into one overall score, which gives us some measure of the severity of the anxiety that people are experiencing at the time that they completed the questionnaire. Essentially, across the 3 categories, severe, moderate, and mild, it was broadly split into 3 equal thirds. Just under a third were experiencing severe anxiety and moderate anxiety, and just over a third mild anxiety. But to have a third of this population, even in an anonymous survey, bearing in mind that this group is, as we've seen from earlier responses, quite reluctant to talk openly about their mental health. You could argue, potentially, with no evidence for this, but it's potentially likely that people may be slightly underreporting their anxiety in surveys like this. To have a third of people reporting severe anxiety, I think is very troubling, reinforces data collected in other surveys, and also just reinforces the importance of prioritising this issue amongst this group. And obviously, we're in particular circumstances at the moment. I'm sure if we did a survey at a time when the economy was low and the amount of work these people were getting was low and so on, we'd see this manifesting itself in different ways. But I suspect the core problem remains the same. If we just go to the penultimate slide, just to give you a really quick overview of the demographics. This population is, as you might probably assumed, predominantly male, average age 47. Just over half were self-employed, and the rest were working in micro firms or small SME. We had quite a range of trades and skills. And one of the things we're now doing is drilling into these, excuse the pun, these groups, particularly to see whether there are particular differences between trades that manifest themselves in terms of anxiety. The initial data suggests there may be some variation in the severity of anxiety experienced by these different groups, but we'll be reporting on that when we get to the report stage. And if we go to the final slide, I'd just like to sort of finish with a few themes and issues that come out of this. I mean, it's really clear that anxiety is very prevalent in this workforce, and that reinforces data collected from other studies. But mental health stigma and a reluctance to seek support make interventions hard to target. And that's essentially where we're at with this group. I think from a government policy point of view, they recognise that across all sectors, people working either by themselves or in very small or micro companies, the health of the workforce in those sectors is a big priority, because they're really hard to get at. If you're working for a larger organisation, you're much more likely to have access to counselling or occupational health support or an employee assistance programme. But for many of these people, none of that is available, and it's pretty hard to get to them and give them the support they need. we see a strong relationship between high levels of anxiety and an elevated risk of adopting unhealthy behaviours, and even an elevated risk of at least considering self-harm, which is obviously a real concern, because we're now, that will be at a really critical end of you know, how anxiety may manifest itself. And if people are feeling isolated or unsupported, then that's something we need to be worried about. I suppose the other concerning thing is that some of the conventional sources of support are not well regarded, and particularly GPs, although trade bodies and some charity resources might have a bit more impact. And although the support and use of those is relatively low, it's certainly higher than some of the conventional clinical sources of support. And I think there's some optimism that if a bit more was done to help those trade bodies and charities to tailor their resources a bit more and target them, then we may be able to make some headway with this group. Despite the sort of slightly catastrophic findings around isolation and severity of anxiety, it's really important, I think, that we focus as much on education and risk assessment and prevention and peer support as crisis management. I recognise that for many employers in this area, it's really important, particularly at the moment, to patch people up as quickly as possible and get them back to work and so on. And that's been the function of many occupational health professionals over the last 2 or 3 years. But you know, there's lots of hard yards to be done here in terms of prevention and making sure the environment that people are working in and the support they feel they can get access to gets people support before they reach crisis levels of anxiety. And I think certainly within this group, we've got worryingly high levels of quite severe anxiety that we would need to worry about. And therefore, our attention, once this report is published, is on trying to come up with some novel ways of using different approaches to getting people the support they need when they need it, before things become too critical. So this is really important research. I think it reinforces many of the things that we've known from other surveys. It highlights the challenges that people are having at this particular point in time, which is obviously an extraordinary period of time. But it does point, luckily, I think, towards some potential improvements and innovations in the way that we provide support for these people. And I'm looking forward to working with Mates in Mind and others to try and make sure that we use this research to come up with some really concrete and practical steps to improve services and access to support. Thank you very much.
Thank you, Stephen. Stark, shocking, as you say, probably not unsurprising findings from that research, and I certainly look forward to seeing the full report when the interviews are concluded and understanding what more the charity can do to support. This is just a quick heads up for everyone on the webinar. You have an opportunity to ask questions to the panel. Please use the chat function and table your question, and we'll do our best to get around as many as we possibly can in the remaining time. Before I do that, I'm delighted to have Dame Carol Black, as I said at the outset, with us to give an initial response to these headlines. Dame Carol has been a huge advocate of pushing the health and wellbeing agenda within construction for more than a decade that certainly I've been involved with Carol. Very well respected. You all know Carol. She chairs the board of Centre for Ageing Better and Think Ahead, which is the government's fast stream training programme for mental health social workers. She is an expert advisor on health at work to NHS England and Public Health England, and she was appointed chair of the British Library in September 2018, and up until August 2019 she was principal at Newnham College in Cambridge. She's a member of RAND Europe's Council of Advisors and sits on many boards, including the Institute for Employment Studies, UK Active, and the Advisory Board of Step Up to Serve. She's authored numerous independent reviews for the UK government, including The Health of the Working Age Population in 2008, Sickness Absence in Britain in 2011, and Employment Outcomes of Addiction to Drugs and Alcohol or Obesity in 2016, and a further two-part review of illicit drugs in England. We're delighted to have Dame Carol with us today. Carol, could I ask you maybe to just give your initial thoughts from the headlines that Stephen has presented to us today?
Steve, thank you, and I'm delighted to do this. First of all, can I congratulate you both on getting together, finding the resources, and doing this truly important piece of work. For those of us who've been interested in the construction industry and the health of the people who work in it, I suppose I have to say it is disappointing to see so much anxiety. I suppose we'd hoped we were making progress, but I think the point is this is a particularly hard to reach group of people, and I think the first thing for us to be aware ourselves is both for the self-employed and those who are working in very small organizations, we have not yet got it right, and this report or this research shows us that. Just thinking of the headlines that Steve has shared with us, I suppose the absolute headline of workload, work pressure, family and financial worries, COVID, and working with colleagues, that may not be so surprising, but the quantity of the anxiety and the response to it is definitely worrying. The response is, I think, certainly slightly atypical of if you had done this in some other sectors. The self-harm is worrying, particularly when we know that suicide is a problem for construction workers. The unwillingness to go to a GP, the non-prescription drugs, all these ring bells, and we have got to think, well, how do we do this differently? The stigma that so many people feel that they simply can't talk about it. Well, if you were in a big firm and you were part of that firm, you would hope that from the top, the CEO and the senior managers would be making sure that you did feel comfortable talking about it, that if they themselves had experienced depression or anxiety, they'd be willing to talk about it, that there would be a better pattern of help seeking, which we haven't seen in these results. And where you go for support, again, that was really interesting. And I would just like to suggest to you that we think about building on what this survey said. I know it's only 300 people, but they answered the survey carefully. And if they really feel at the moment they don't wish to go to their GPs, and goodness knows GPs are so overworked, so they may not get a good response. How do we enable the trade bodies, the charities, the organizations they do support to do this more effectively? And how do we think perhaps more effectively about peer support? Because they were happy to talk to their family and their friends, and is there a better role there for peer support where perhaps a bit of training has been given? The physical symptoms were also important and interesting, and as Steve said, tied in to the mental health issues. And I was thinking when I looked at these results, could we consider perhaps offering an MOT? I think most people who work in construction would be concerned about their physical health, their ability to go to work every day. And perhaps if we could think of a holistic MOT, and if there were the resources to make that available, you would be approaching these workers in a rather different way. And it may be perhaps a backdoor way in, but one we might consider. I think it will depend on the age of the worker, but I do think trying to get to workers through apps and online may be a good way of thinking about it for the younger worker. The lack of sleep is very noticeable, and was trying to think, there's so many good things out there about sleep and helping you improve your sleep pattern. How do we include that? And then there are so many good things about helping workers with their financial concerns, but how do we get to this particular group? So I just end by saying thank you for doing this work. It's a fantastic piece of work, but now how do we start to think differently to really put forward some good ideas that actually we can turn into practice?
Excellent, thank you, Carol. Just a reminder that the chat function is open if you have any questions. We'll keep an eye on that. If I could possibly start for a question for both Stephen and Carol. It's now more than 4 years since the Stevenson Farmer review was published. And personally speaking, I've seen some positive steps around mental health and well-being in the workplace, particularly on larger projects, which is where I've worked predominantly. But what I do note is SMEs and micros and the self-employed, as always, appear to be further behind. And this research is supporting that. I said at the outset, I wasn't necessarily surprised. Stephen, Carol, what do you think is needed urgently to reach this group, which makes up more than 80% of those working within our sector? Stephen, perhaps come to you first.
Yeah, thank you. I mean, I think many of the ideas that Carol's suggested there are really very sensible. I mean, it does seem to me that if we got in this survey and other surveys very clear evidence that this group feels very, very reluctant to talk about their mental health openly with people outside their family, and certainly people in clinical roles, then we need to find another route. And I think the idea of an MOT or a health check that is much more holistic, that talks to them about their sleep or their financial well-being or their back problems and so on, I think would probably be a slightly more acceptable way of doing things. And then through that, you will get to conversations about, you know, how this affects their mood and so on. And I would certainly not use loads of clinical language. I think talking about mood is far better than talking about anxiety, because that can be quite triggering and difficult for people. I think the other thing that seems to be happening, which I think may be another potential positive thing, is that we are witnessing a really significant shift in society about you know, talking about mental health much more acceptable. I mean, you know, even 5-10 years ago, getting a footballer or a cricketer or you know, someone in the media to talk openly about their mental health would have been quite difficult, and that's much more common these days. And I'm hoping that, particularly for this group, you know, that may be beginning to move the dial a bit and make it feel a little bit more acceptable to have those sort of discussions. So the real challenge is to find, you know, people in support roles within the charity sector, for example, people who are able to use the right language and open that conversation in a way which is non-threatening and which people can very quickly see that it's going to make their life better and give them the opportunity to get the type of support they need in an acceptable, non-judgmental way. I think maybe the way of doing this. And so I'm certainly a strong advocate of what Carol was suggesting about the sort of MOT, you know, less direct way of talking about mental health. I think for many people that still turns them off.
Thanks, Stephen. Carol?
Well, I mean, I think Stephen has really said most of it. I think probably if you think about the Stevenson Farmer report, it was not really and probably never was intended to really get to the people we're particularly trying to help now. It was at a sort of high level of setting standards and then super standards, and really advocating for organizations to take these up, do something about them. And I mean, instructions to HSC to revise their guidance on mental health and increase employer awareness. But of course, HSC has anyway that in its statutory responsibility. It has psychological health there. So perhaps we're hoping for too much from that report. when we really got to get down, as Steve has just said, into the nitty gritty of a special group of individuals who we really need to help. Just in doing the work I've been doing in the last 2 years on drugs, I did see and have seen the power of peer support, of somebody who's been on the journey. And that is really to talk to what Steve has said, don't make it clinical. It's no use me telling someone with a drug dependency problem what to do. I'm a medic, you know, but the power of someone who's been in that place, and how do we, is there a way within construction we can make use of that, if we could only get over perhaps this reluctance to talk about it, because peers are very powerful people, I think, in this role.
Absolutely. Thanks, Carol. We've got some questions from our attendees. Delighted to see that. I think this one's for you, Stephen. What level of mental health awareness and training did the survey respondents receive, if any?
As far as we can tell, not very much. I mean, you know, I think the fact that they seem to be far more comfortable and reliant on family members, for example, probably testifies to that. And obviously, bearing in mind that, you know, these people are mostly not working inside an organisational structure at all, or if they are, it's very loose. You know, I'm just thinking, my own son is a carpenter and he works for somebody, but I wouldn't call it a company particularly. I mean, it's two blokes, you know, out there working together, and they try and support each other. But I wouldn't say that there's a very easy route for either of them, really, other than talking to each other to get the type of support they might need. I mean, I was talking, as Carol was talking then, I was thinking that, I mean, obviously we've talked about supply chains quite a bit. Obviously, Steve, you'll know about this from your work at Tideway and across the larger organisations in the sector. I mean, obviously that is a potential way of doing things. I'm doing a piece of work at the moment, completely different sector, with John Lewis Partnership, who are developing a whole series of interventions to work with SMEs in their supply chain in the UK, focusing on this concept of better jobs. The idea that, you know, people are in jobs where they have control and autonomy, and they have access to this type of support around well-being, that, you know, that will make them more productive businesses, and that's actually going very well. And what we found in that study is that, without twisting their arms too much, it's not a requirement to do this in order to be a supplier, but some gentle nudging of the very small companies who are working in their supply chain, and providing them access to resources they couldn't afford otherwise. They found they've moved the dial quite a bit on promoting well-being at work in some of their supply chain companies. There's about 40 of them that we've been doing sort of data collection from. And the idea now, the next stage of that work, is to take that to suppliers in India and China, for example. So from a commercial point of view, you know, for the big employer, there is some you know, some payback from that, because you're aligning your suppliers with your values, and you're getting them to make sure they're looking after their people as well as part of that. Now, I know that's something it's been happening a little bit in the construction sector too, but it does seem to me there's no one solution to this, and that, you know, big employers with supply chains, but also, you know, clinicians and other, and the third sector have got a role to play in this. But for this group particularly, they're not getting anything like the type of support that a mainstream employee in a larger or even medium-sized organisation is getting. And so all the progress we're making in those sectors, across those other larger organisations across different sectors, is completely missing this group. And that's why this piece of research and what we do with it is so important.
And I think therein lies the challenge in getting to those that are outside of the big supply chains. And as you say, your son and his carpenter mate, how do we get that message across? Interesting. We've got a question here that I think I'll come to you, Carol, on this. Interesting data around the role of GPs, or lack thereof at the moment. Could this be about the emerging difficulties of trying to get a GP appointment rather than the principle of speaking to a GP about mental health? GP primary care must remain a crucial part of the picture. should we be recommending other sources of support or working to encourage or support people to access their GP?
I mean, I think this is a really important question. I mean, there has been, of course, both a difficulty in getting an appointment, if I understand it correctly, and in certainly getting a face-to-face appointment. I think the real question for me is, even if we could do that, is this the best person in the general practice or in primary care to help you? I mean, could it be that within the general practice, if our GPs are so very busy and overworked, would the workers we're interested in be prepared to talk to a well-qualified nurse within the practice? Or would they be prepared, if in a few, I know of a few very good practices where there are employment advisors. I mean, if they again had the right training, can we use the concept of general practice, but sort of broaden it rather, so that we're not totally reliant on you having to get to the GP? Because I just fear that at the moment, with the best will in the world, that may not happen. So sort of again, trying to think rather more laterally about how we go. There's no easy answer to this, and I know what it's like if you're hanging on the phone, you can't get through, and you're trying to be at work, and and then if you've got to book a time for a phone call, everything puts barriers in your way of getting some help.
Excellent, thanks, Carol. Stephen, any thoughts on that?
Yeah, I think as someone who's tried over the years to try and get GPs on board in research studies about return to work and using the fit note and so on, it's a tricky problem, because in many cases GPs see themselves as the patient advocate, and therefore anything that looks like it may be linked to benefit conditionality or access to DWP and so on, people get very anxious about it. And GPs don't have a lot of time for this sort of stuff. And as we've seen from the fit note, they've not been fantastically compliant with that, or not used the fit note to its full advantage. I suppose the other thing I wonder about, I mean, in the process of getting people to fill the questionnaire in, we did, particularly through Mates in Mind colleagues, talk to a number of retailers and wholesalers, where people, essentially, if construction workers are going to get supplies, that's where they talk to each other, that's where they get access to other information. And I think if we marry that together, say with Carol's MOT type proposal, and enlisted the support of people in the trade to be a sort of a channel through which this information could go, then in some ways that might be a slightly more successful and acceptable approach to doing this. And also, you might argue that once someone's decided to go to their GP, they're probably quite badly feeling the anxiety. It probably takes them quite a bit of effort and to be quite brave to go to your GP. What I'm hoping is that we can try and find things that are a bit more upstream, and so perhaps using retailers and trade suppliers and so on, among other sources, may be the way to do this. And GPs should play a part, but we shouldn't overburden them with expectation.
Thanks, Stephen. From a personal perspective, this is not a silver bullet solution. We need the basis for the Health and Construction Leadership Group, and where Mates in Mind came from, was the fact that we needed to have a collaborative approach. It needed to be clients, it needed to be big contractors, trade bodies. Probably we need to extend that now to reach out to government, to reach out to GPs, yeah, and say, how do we collectively wrestle this? Dylan Roberts, who's one of my fellow founding members of HCLG, has put a question in there, which I think is very apt. In terms of maintaining good mental health and preventing poor mental health, what do the panel see as key to creating a safe environment? By this, he means reducing pressure on workers and creating certainty, and people controlling their working day. So I think this is about the environment in which we're working in construction. Stephen, did you pick anything up from the survey on that?
Yeah, a little bit. I mean, I think if people are feeling under a massive amount of work pressure, what we've found in other studies we've done in engineering, for example, is that people are actually able to cope with pressure pretty well if they feel they have control and if they have some sort of, discretion over what tasks they do, when they do them, if they have a degree of autonomy. And I think if people are under loads and loads of pressure, then that gets squeezed. And so I think if we can try and find ways of helping people to develop coping strategies that give them the ability to step back a little bit from the pressure that they're under, find alternative ways of, perhaps getting support, then that might be a fruitful avenue. That's obviously a lot easier if you're working with several other people. I mean, we're doing a couple of studies now where, looking at things like job design and looking at the boundaries between jobs inside organisations is one of the ways you can help people relieve pressure over time. Unfortunately, that's not a luxury that many people who are self-employed have. There are some studies that show that self-employed people's mental health is much better because they enjoy control and autonomy and they can control what's going on in their lives. But there's an equal number of studies that show that they're worse off because they're under so much pressure. They've got no escape route. They've got no way of decompressing. They've got no way of letting off the pressure, and they take it all on themselves. And they develop a mentality that says, "I'm the only person who can sort this out." My family is completely dependent on me bringing in an income. I've got no other support around me who can take the pressure off, other than by hiring, somebody else to work with me, which I can't afford to do. And so people get into that slightly difficult downward spiral of mental health problems where they feel that there's no escape route for them, and yet they have to keep plugging away and doing the job under massive pressure without support. Otherwise, they're going to lose their income and their family will suffer. And I think that we're seeing quite a lot of that in this survey.
Excellent, thank you. There's a question here. I think I know the answer. It's what role do mental health first aiders play in all of this? And we've just talked about collaboration, and obviously there's a great deal of awareness with mental health first aiders and their growth within the industry. Talking about creating that positive environment, I still see the mental health first aider as somewhat reactive in that sense, if you compare it with the physical first aider. So we should really be putting our attention into prevention in the first instance, but nevertheless, it's a key resource. Carol, any thoughts on how you've seen the manifestation in volume of mental health first aiders coming into the industry?
Well, I think you've hit on a very important point there, Steve. I think one of the other things, you won't be having a mental health first aider unless you've got a reasonable sized organization. So again, it's this problem of how do you get people like mental health first aiders really to the people we're interested in. And I would be a very strong advocate of what you've just said about how do we try and go a step higher up the chain, because really, you really want to try and prevent that. And therefore, it's trying to get this dealt with at a much earlier, an earlier stage. I just think for the group we're interested in, that probably, I don't quite see how they were going to get access to this. I mean, I suppose some people would say, well, there's also access to, the NHS and IAP services where there should be employment services within them, but there's such long waiting lists. I mean, it's everything we would like to make available. It's not easy to get them for our group. So I just wonder, can you deliver anything more upstream for probably for the younger worker on an app or, virtually? Is there some way of engaging when we're just feeling a bit off, rather than when we're desperate with, severe anxiety? You need it upstream.
Yeah, definitely. Thanks, Carol. Appreciate that. Another question from one of our HCLG founders, Clyde Johnson. I think I'll answer this one swiftly. Clyde talks about, we form Mates in Mind on the back of there being nothing in construction, and and a particularly high suicide rate. The Office of National Statistics confirmed that through their research back in 2019, I think it was. And Clive's asking, has there been any change in that? I think I'm right in saying no. Would you agree, Stephen, from the access to data that you've had?
Yeah, no, I don't think we've got any more recent data than that. I know in general, suicide rates haven't really changed very much during the pandemic in the wider population. So that is great news, obviously. But I mean, I suppose you're picking up a few threads from previous bits of our conversation. It does seem to me that perhaps one of the audiences for our research, obviously not just within industry, but we may need to have a think about how we take some of these messages to colleagues in DWP, parts of the NHS. I know that the Joint Work and Health Unit in DWP is very interested in this issue, and sees self-employed and people working alone as being a hard to reach group for policy too. And some of its more recent research on the coverage of, for example, occupational health support consistently shows that this is a group that is in great need. So I think one of the things we can definitely do is take some of the messages to policymakers. May even be worth convening another a webinar to focus on this a little bit more with colleagues from organisations like Mind and others who are working on the ground in different sectors, and there may be perhaps lessons from other sectors that we could learn too.
Brilliant, thanks, Stephen. And I'm really going to put you on the spot because we've got 2 minutes left, and this is probably a question that requires a much longer response, but I'm going to start with you, Carol. What is the one biggest step we can take to destigmatise?
I think it is, if we can, to be able to talk about it, to make it normal. And again, it usually comes in employment from the top of the house through the managers and down, and that is again for our group not so easy. But construction itself, and all of you in construction, could start really. I mean, could you envisage having a campaign on this within construction? Because it is a peculiarly difficult problem. So I think it has to be talking about it, normalizing it, me saying, I've been depressed and look, I'm here, I'm okay.
Thanks, Carol. Stephen, final word.
Yeah, I agree with that. I think that one of the problems we have is we sometimes catastrophize mental illness, and we sometimes over-medicalize it. It is a normal part of life. I think it's brilliant that we've got a wider societal dialogue on mental well-being at work. Lots of really prominent people talking about it openly. That will filter its way through society, I think, and I think we need to ride that wave. But obviously, with this group, we've got quite a lot more to do.
Brilliant, thanks, Stephen. We're just about at close. Before we do, may I once again thank Stephen and Dame Carol for giving us their time. Stephen, really looking forward to the full report and how Mates in Mind can do more to support. For those who joined the webinar today, thank you for that, and thank you for your questions. And please watch out for that health and safety at work report session that Stephen will be chairing. And if you haven't already put your name down, please look that up and get yourself along for what I think is a really important piece of work to help us shape this for the future. Thank you all very much. Have a good day.